Hey everyone, welcome back to another episode of the DrBicuspid.com podcast. My name is Kevin Henry. I'm honored to be the editor-in-chief for Dr. Bicuspid and also honored today to have on Caitlin Parsons, RDH. Hey Caitlin, how are you?
Hey, good. I'm happy to be here.
I'm so glad to have you here, and I'm so glad that you wrote an article for me for Dr. Bicuspid. It's called Integrative Approaches to Burnout in Dentistry, Combining Ergonomics, Yoga, and Mindfulness. And I really want to dive in a little deeper into that article today, if that's all right with you. But before we do that, I'd love for our audience to know a little bit more about you.
Yeah, thank you. So my name is Caitlin Parsons. I'm a practicing dental hygienist. I've been a dental hygienist for 15 years, and now I'm a ergonomics consultant, yoga therapist, and the founder of the Aligned Hygienist. But a big part of my story was a year into practicing as a dental hygienist. I started experiencing multiple areas of work-related pain, neck and shoulder, low back, and it got me into yoga and realizing that there has to be something therapeutic for the work we do that's not just a generalized yoga class. And it led me on what is now my mission to help dental professionals feel good.
And I love the fact that you were proactive. You didn't just try to work through it. You tried to figure out a way to get around it and to actually beat it. And that's fantastic.
Well, I ignored it for a while and I hoped it would go away and I did all the common things. And then I realized it's not going anywhere. I need to figure this out. Yeah.
So I do want to touch on some things that you wrote about in the article. And one of the things that, and as you just said, the subhead was yoga therapy tailored for dental work. So, would you just talk a little bit about yoga versus yoga that actually helps dental professionals and maybe what you see the difference being?
Yeah, this is a topic I'm really passionate about because just like there are so many dentists, dental assistants, hygienists, not all of them are created equal. So there's so many different styles of yoga. Again, it would be like going into one dental office and expecting all of them to be the same. There's so many different styles. Some are going to be more fitness based, more exercise based. Some are going to be more like restorative, laying down most of the time. What I describe, what I teach is almost like physical therapy meets yoga. So yoga therapy is getting bigger and bigger outside of just yoga, and yoga therapy can be used for anything. It can be used for people that have chronic illnesses, it can be for cancer recovery. So there's so many things that we can do with it. So as a dental hygienist who experienced chronic pain, a lot of what I teach is based on how can we reduce areas of tension from the work that we do from sitting all day? How can we build strength to have better posture to support ourselves in a natural way and be in better alignment? How can we rebalance our body from sitting with specific movement? And then using the breathing exercises and meditation to reduce stress, to feel better, to be more present, more focused, more clear with our patients. And when we're incorporating all of these, it naturally just helps us prevent burnout.
And I want to get to the stress side of things in just a minute. So hold that thought.
Yeah.
But one of the things that you talked about in your article were chairside stretches and a lot of things to do in the practice to really help you combat some of the pain that you might be feeling. But you know, and I know, and we both heard, well, there's no time for that. How do I work that into the schedule? So that's where I want your expert opinion. How do you work that into the schedule and make sure that you're actually doing these things during the day that you need to do?
Yeah. And believe me, I've been a very busy hygienist claiming that I have no time to do anything, drink water, go to the bathroom, anything. And there are opportunities and times. I mean, even when we are reviewing our notes for the day, there are some neck stretches, some hand stretches that we can do during that time. When we are waiting for our patient, or I say this all the time, when we're waiting for our patient and then our patient arrives and then they have to go to the bathroom and then they get in the room and then they have to use the phone. Like these are all little opportunities. If you're a doctor or a hygienist, when your patient's getting numb, but even, I mean, a team can incorporate this at the beginning of their day during the morning huddle. Or I've heard of offices like right before they go on lunch, they do a few stretches together. Or as they finish their day, they do some practices together. I think a little harder to get a full team on board, but when we're looking at each individual, there are so many little moments when we're walking up to get our patient, we can do a stretch. So It's all about kind of optimizing our moments throughout the day, and this goes with everything. This is how we can incorporate different breathing exercises, right? Is almost like habit stacking. Like what are we
Mhm.
already doing and where could we incorporate it?
So is this something that a doctor listening to this, an office manager listening to this, whoever's kind of in charge of that schedule, is this something that he or she should kind of keep in mind to have those moments in the day and to encourage the team members during the day to actually take advantage of that?
I think that is great when the team can work together and holding each other accountable. I think that's when we get kind of the most momentum and results. But on an individual basis, it's up to us to take care of ourselves to feel good. And it's those moments of, am I going to check my phone and respond to messages during this break, or do I want to reset and just do a couple of stretches?
And boy, that's a tricky one right there because
I
I
know.
know,
Sometimes we got to check the phone.
we have to stay connected somehow, but yet we also have to keep the long-term goal in mind. And if that is making sure that you're as pain-free as possible and that you're not hurting during the day, it's worth those few moments to do that.
Yeah, and I really think that if we're like, I have a PDF with a bunch of different stretches, so you can literally go and if you have a specific area of pain, you might focus on that area, right, as you do your stretches. And maybe you don't have pain, you want to prevent it, so you're doing kind of the whole body. But you can do one at a time, and if you have it right out there with you, you just know what you're doing and you kind of create like a little sequence for yourself.
So that stress that we put the pin in a minute ago, I'm going to bring it off the board here and let's talk about it for a minute because you mentioned in the article cultivating mindful moments in a busy dental practice. And we know stress rises out of nowhere. There are times that, you can't find the lab case, the patient cancels at the last minute, whatever it might be. How do we take that moment to kind of recenter in your mind?
Yeah. One of the easiest ways to do that is just by focusing our awareness on our breath, on the way that we are breathing. Our breath is directly connected to our nervous system. So if we're in a state of stress, we're overwhelmed, right? Our patient's here, we have to write our notes, we have all this to do, our neck patient there. We tend to be we have a faster breath, right? More shallow typically. We're in a sympathetic state. So just by focusing on your breath, by slowing your breath down, typically slowing your breath down signals a more calm state or shifting to that parasympathetic nervous system. So that is one thing we can do is just slow the breath down. There's different breathing practices we can do. I think I shared in the article like box breathing. But these are practices that like no one needs to know, not our patient, not our assistant, not anyone has to know that we are doing these breathing practices, but it's almost one of my teachers says body leads, mind follows. So it's almost like you're tricking your mind by getting your body into this breathing practice or whatever.
And you mentioned the mind, so there's one thing that I found very fascinating in your article, and just so everybody knows, we're either going to link to this. If you're watching this on Dr. Bicuspid, it'll be in the article. If you're listening to this on Dr. Bicuspid, it's going to be in the show notes. But it was integrating mindfulness in a daily routine, and you talk about how that even those routine tasks can be moments of mindfulness, like washing your hands or whatever that might be. And I thought that was really a fascinating thing because so often our mind is already thinking ahead to what's next rather than what's in that moment.
Yeah, I realize that for myself. I'm a very busy body. I'm go, go, go. So when I'm in clinic, when I'm cleaning my room, I'm thinking about the next patient or I'm writing my notes in my head for my last patient, right? And I actually started to take the time while I was cleaning my room to just be really mindful, to just focus on my breath, focus on my posture. I'm a tall person. I can slouch when I'm cleaning a room. Usually it's harder. So I just focus on that, the way that I'm walking, the way that I'm breathing, the way that my body feels. And it's like a small moment that we really can't do anything but clean the room anyway or talk to someone maybe. And it's just an opportunity to reconnect, another touch point with ourselves.
And I want to try to bring all this back home because I know a lot of people are listening to this and thinking, how could I do this? What could I do? And yet we know so many hygienists, assistants are leaving our industry because of various reasons, including pain, including that their body's breaking down. And so this is an opportunity, I think, to make sure our team members stay in the practice and stay in their careers longer as well.
Yeah. Yeah, I think this is important for, again, individual practitioners and clinicians to take care of ourselves, but also on a team, a practice and industry level. There it is concerning. I think since COVID, how many people are leaving or are scared to even come into dentistry, and it's pain, it's stress, it's burnout. And so how do we find solutions? A big part of it is our wellness, our taking care of ourselves. We work with people all day. We have to take care of the person taking care of the people.
And Caitlin, I've got to ask you this question because we have all different generations that listen to this, read the article. Do you find there's a generational difference between accepting yoga and mindfulness and everything else versus, the older generation versus the younger, dare I ask?
That's a really good question. I get pushback from every generation. I think the older generation, especially I'm from the East Coast, so even me getting into yoga at the age of 23 was crazy. I was not a yogi at all. Um, there is a lot of skepticism, especially when it comes, I think, to people in dentistry, because yoga has a stigma. Yoga now is more fitness based. It's popular. It's fancy clothes. It's fancy poses. And so for me, as someone that's here to teach more of a therapeutic approach, I definitely get pushback. And I would say the younger generation is probably, especially in dentistry, I'm noticing more aware of our issues and more wanting to focus on prevention. So in that way, maybe more open to it.
Okay. And last question for you. You've talked about a lot of different things, and again, I want to encourage everybody to read the article. If you could wave that magic wand as we head into 2025, as we start looking ahead, what would be the one thing you'd want dental practices to do whenever it comes to mindfulness, taking care of themselves, etc.?
I would love to see more practices incorporating any type of wellness into their practice, whether it's getting someone to come in for ergonomics, whether it's a quarterly yoga class, or it's morning huddle stretch, or, even like, uh, I'm trying to think of like a game that, people focus on their fitness, whatever it is, but more awareness, more focus, more support for the team and wellness.
Well, you mentioned the PDF earlier. I know that you're a valuable resource whenever it comes to ideas like this for the practice. So I want to make sure people know how to get a hold of you and how to learn a little bit more.
Yeah, yeah, you can find I can share the chairside guide with you if we want to put it below, but you can find me everywhere. I'm the Aligned Hygienist. So on Instagram, my handle is the Aligned Hygienist. My website is thealignedhygienist.com. I do have that PDF and a couple other freebies on there. And if you want to email me, message me, you can email me at hello@thealignedhygienist.com.
And we'll have all that in the show notes as well to make it real easy to get a hold of Caitlin. And Caitlin, I just want to thank you because you were the one who reached out to me to say this is important. I want to make sure that I reach your audience. So thank you for being front of mind with that for the Dr. Bicuspid readers.
Yeah, yeah. Thank you for having me, and thank you for being open to yoga.
Absolutely. I know how much, in all seriousness, I know how much it's helped my wife get through some of her pain and her flexibility. So I know it's an important thing for sure. So.
That's awesome.
Well, Caitlin, thanks so much. And thanks to all of you who've listened to this episode of the drbicuspid.com podcast. We're going to touch on all different areas of your practice to help you not only have a better practice, but that better culture to help your team members enjoy what they do more and be ready to come back into the practice the next day to touch all those lives that they do every day. Until next time, Kevin Henry, host of the drbicuspid.com podcast and editor-in-chief for Dr. B, signing off and wishing you nothing but success ahead.